Hello, I am Dr. J. Sreekanth, the Senior Consultant, Internal Medicine, Apollo Health City, Jubilee Hills, Hyderabad. Today we are going to discuss something about the sleep disorders. Most of the sleep disorders have some medical comorbidities. Very few are genetically mediated. The commonest sleep disorder which we can talk about is insomnia, means failing to have proper sleep. This can arise in a variety of settings, acute and chronic. Mostly the depression, anxiety, all these things would contribute to insomnia and has to be attended medically. The second commonest disorder is the sleep apnea, where the patient fails to breathe during sleep. This is something which is very serious and has to be attended because it may lead to hypertension and other disorders. Sometimes the patients may need the help of CPAP machines. The third commonest disorder is the Restless syndrome. Here the patient starts moving his lower limbs and extremities during sleep. This can again arise because of various medical disorders. Commonly the B12 deficiency, dopamine deficiency, and this has to be corrected medically. The fourth disorder is something which has to do with the central nervous system, known as hypersomnolence. This can happen in case of benign tumors and where the areas are affected because of the lack of blood supply. Again, this has to be treated medically. When it comes to the genetically mediated disorders, you have parasomnias or somnambulism. This is, in other words, known as sleepwalking. It's very common amongst the kids, and amongst the adults, 4% of them they do suffer. This has to be evaluated by the medical experts and proper counseling has to be done. And lastly, you have an entity known as narcolepsy, wherein the patient has sleep paralysis and he also has hallucinations and sleep distorted versions. This also has to be evaluated properly and attended with proper counselings.